Don't worry, doc, my patients say. I can always tell when my blood pressure goes high. I can feel it. But the question is that really a thing? Can you really feel when your blood pressure goes high? Is it reliable? Guys, I'm Dr. Jen. It's good to see you. Welcome. First of all, let me say that oftentimes when my patients are saying this to me, they're saying it usually in the context of taking or not taking their blood pressure medications. I've had patients who only take their blood pressure medications when they feel their pressure is high. Now, while this video is not on that specifically, let me tell you, blood pressure medication should be taken only as your doctor directs. And to be honest with you, most high blood pressure medications are indicated to be taken regularly, not as needed. I'm not your doctor. You got to get the information and the instructions from your doctor. But let me tell you, this idea of gauging when your pressure is high and taking things when needed, that's not going to fly, okay? But back to the question at hand. Can you actually feel when your blood pressure goes high? Well, we call high blood pressure or hypertension the silent killer for a reason. In most people, high blood pressure is silent. You don't feel it. And in fact, patients can have very, very, very high blood pressures, over 180. I've had patients with blood pressure in the office. They come in, their blood pressure, the top number is over 220. They had no idea, okay? So most people do not experience symptoms when it comes to high blood pressure. There are some people who say they get, say, a headache or they might feel a little dizzy when their blood pressure goes high. And that certainly might be the case for some. But that's not a reliable indicator because remember, you can get dizziness or a headache even when your blood pressure is not high. So yes, there are some people who get that, but it's not reliable and you shouldn't rely on that or whatever symptoms you think you get to determine when your blood pressure is high. The other thing I should say is that when blood pressure goes like literally off the rails through the roof high, we're talking hospitalized patient high, malignant hypertension, that's in the realm of when we're starting to notice that someone's organs are actually being damaged because the pressure is so high, the kidneys are being damaged, etc. Sometimes people can get chest pain, shortness of breath, confusion, etc. But again, that's a very extreme situation. That person is generally in the hospital or hospitalized, things like that. The bottom line here is that for most people, no, you don't feel high blood pressure. Yeah, there are some people who might feel symptoms when they get high blood pressure, but that's not reliable. And that's not the way you should be judging whether your pressure is high based on how you feel. You should only be judging it based on what the numbers show, your doctor's numbers, your numbers, and whatever plan you've worked up with your doctor. So I hope this is helpful. Let me know in the comments. Share this video with other people. I'm going to link to this video, a video playlist on high blood pressure. I have videos on what foods exacerbate high blood pressure, which foods help it, medications, all sorts of things I know you probably want to know, how to check your blood pressure at home. So make sure you check out that playlist. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on everything. Please subscribe to my channel on YouTube. Please follow my page on Facebook. Check me out on LinkedIn, Instagram, WhatsApp, TikTok, all the good things. Guys, I'm Dr. Jen. Oh, sign up for my free health newsletter at drjencaudle.com. All right, guys.